from the FDA and will give us an update of the agency.
Thank you. I'd also like to thank my colleagues, my colleagues at FDA from the agency, but also international colleagues, because I think this forum is really a result of a collaborative work and a communication that has developed in the past few years. And as you realized from the building on the first declaration of Basel, we have had some goals where we communicated and harmonized a number of things where we are very successful, and those are shared with the public, and I think everyone benefits from that. And recognizing this mutual beneficial effort, we built onto it, and we were very pragmatic to target some of the areas where we think it is very critical to make some progress internationally and also synergize on the efforts that we have, because we all have limited and restricted resources in some ways. So as such, specifically I would like to thank Catherine Tyner and Anil Patri, who also helped me to put these slides together today with the purpose to share the updates that specifically came from FDA in the context of some of the publications here, specifically in the AAPS journal, which opened a theme on nanotechnology in complex drug products, learning from the past, preparing for the future. So that targets current status and historical perspective of drug products containing nanomaterial. And there are two specific editors from FDA with the web link, so that you can, of course, click on it if the slides are available, or if you take a picture, you can find it by Googling it. There's also another article, How Has CDER Prepared for the Nano Revolution? It is a review of risk assessment, regulatory research, and guidance activity. And it targets recent publications from FDA CDER, providing feedback information on our research and review processes, again with a link. Then we published some guidance documents, FDA overarching guidance on nanotechnology, a revised liposome guidance, and information about critical quality attributes. CDER maintains a database of drug submissions that come to the agency containing nanomaterials, and did a comprehensive analysis on the database, which was recently published in Nature Nanotechnology, again with a link there. Specific quality considerations for classes of products are reflected in an AAPS article. Development considerations for nanocrystal drug products, as well as an article on liposomal drug product development and quality, current US experience and perspective. In the region of standards, you have heard Anil Patri, of course, emphasizing this as a very important issue. And it's not about standards that are irrelevant for regulation to calibrate your instruments. Those are standards where the complexity of some of the issues really facilitates new method development and update of methods to become suitable for the very complex drugs that are being developed. So in collaboration with ASTM, the E56, the ISO TC 229, and USP, nanotechnology subcommittees contributed to developing and providing input to standards that are used for products in FDA regulation. And as you can imagine, it not only helps the regulators, but the entire field is brought forward if we can compare apples to apples and read the book from the same page. It saves a lot of time. There was also an USP workshop on drug product containing nanomaterials, and there was a very high participation from industry. Again, some information here on the link as indicated. I would also like to encourage other regulatory agencies, if they listen in from other regions, to join the group, to participate in the open platform that we provide. We do have confidentiality agreements to exchange information in the case we have to. And of course, there's also the opportunity to do this on a restricted or on a exclusively public basis, where we don't necessarily have to create bilateral specific relationships. With that, I would like to thank the CLINAM team, and specifically Beat, having provided CLINAM as a platform for international regulators to actually meet face-to-face, and also to Elke Anklam from the European Union to get really engaged and roll the sleeves up to get this work done. And we all agree we have a lot of work to do, but we are excited about the future and the opportunities that we have. And I also like to thank Michael Johnson from Health Canada, who took over the new chairmanship of the group. With that, I thank you, and let's continue to hear from the other regions.